Hello everyone, I'm Professor Bisaya and I will be showing you medication administration for skills validation. So I'm going to start by completing my MedCheck 1 by comparing my doctor's orders against the accuracy and completeness of my MAR. So I see here that I have the right patient, Susan Cruz, right medication, heparin, right dose, 5,000 units, right route, subcutaneous, right frequency every 8 hours, right time due 0900, and I'm going to be completing the right documentation at the end. The next medication here is going to be the right medication, Keppra, right dose 500 milligrams, right route intravenous piggyback, right frequency every 12 hours, right time due 0900, and I'm going to be completing the documentation at the end. That concludes my MedCheck 1. My MedCheck 2 will start by me pulling my medications from my med cart. So I'm going to go over here, grab my medications. I know that I'm going to be needing a needle for my subcutaneous heparin. I'm going to need some alcohol swabs. I'm going to go down here and grab my heparin dose. And right over here, I'm going to grab my IV piggyback medication and the tubing. Now I'm going to start my MedCheck 2 by comparing my medication against my MAR. Right over here, I have right patient, Susan Cruz, right medication, heparin, right dose, 5,000 units, right route, subcutaneous, right frequency every 8 hours, right time due 0900, and I'm going to be doing the right documentation at the end. Next, I have my Keppra. I have the right medication, Keppra, right dose, 500 milligrams, right route, intravenous piggyback, right frequency every 12 hours, right time due 0900, and I'm going to be doing the right documentation at the end. At this time, I'm going to check my medication's expiration date. I see here that my heparin expires January 1st, 2050, so it is safe for me to administer. And I also have my Keppra, which expires January 1st, 2050, which is safe for me to administer. Now I'm going to go into the patient's room, and I'm going to go ahead and knock, knock, knock. I'm going to go ahead and enter the patient's room. I'm going to go ahead and perform hand hygiene per CDC guidelines. And I'm going to go ahead and don clean gloves. I'm going to do my general environmental safety check by scanning the room and ensuring that the bed is at the lowest level, the bed breaks are set, and my emergency equipment, oxygen and suction, are prepared at the bedside and are working properly. In which they are. And I'm going to go ahead and introduce myself. Hi, my name is Carisha, and I'm going to be your nurse for today. I have all of my supplies. I'm going to put them on my bedside table. I'm going to go ahead and check my patient's armband. Hi, Miss Susan Cruz. Like I said, my name is Carisha. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth? Okay, I see it's Susan Cruz, 4/4/1950. And I see that you have an allergy band. Are you allergic to anything? Okay, you're allergic to NSAIDs. Thank you very much. So Ms. Cruz, just a little tidbit as to why I'm here. I'm going to be administering your medication for the morning. It's almost 9 a.m. and so I have an injection for you, and then I also have an IV medication that I'm going to be hanging into your IV. Okay, and so I'm going to go ahead. I've already assessed my pertinent labs to my medication, and so I have checked that Mrs. Cruz's sodium levels are at 136, which is within the normal range of 136 to 145. And then I'm also going to be giving a blood thinner. So I have my platelets, which is at 350,000, within the normal range of 150,000 to 400,000. And I also have the PTT at 38 seconds, which is within the normal range of 30 to 40 seconds. At this time, I'm going to go ahead and assess your skin, Mrs. Cruz. So I'm going to go ahead and lower your blanket a little bit. I'm going to lift up your gown. I'm going to be giving your medication into your abdomen, so I'm just making sure you're free of any bruising, redness, wounds, or any bleeding at the site in which you are. And then I'm also going to be checking your IV site, make sure it's not leaking, it's free of any redness, erythema, and making sure that the IV is patent. So as I follow it up to my IV line, I see that it is flashing green. So my IV bag is infusing and it is patent. So Mrs. Cruz, like I said, you're going to be receiving heparin, which is a blood thinner. Common side effects for heparin is going to be bleeding and bruising. So if you experience any of that, just go ahead and let me know and I can take care of that for you. And I'm also going to be giving an anti-seizure medication, which can make you sleepy and drowsy. So if you feel any of that, just let me know. Do you have any questions at this time? No, you're good to go. You've gotten these medications before. Okay, great. So Mrs. Cruz, I'm going to go ahead and have you verify your name and date of birth for me one more time. So I see that your name is Susan Cruz, date of birth 4/4/1950, and you have an allergy band because you're allergic to NSAIDs. Thank you so much. Okay, so I'm going to be doing my Med Check 3 at the bedside against my MAR. So here I have the right patient, Susan Cruz, the right medication, heparin, right dose, 5,000 units, right route, subcutaneous, right frequency every 8 hours, right time due 0900, and I'm going to do the documentation at the end. Next I have Keppra, right medication, right dose 500 milligrams, right route intravenous piggyback, right frequency every 12 hours, right time due 0900, and I'm going to be documenting at the end. I have also assessed to ensure that my Keppra is compatible with the IV fluid that is infusing inside the room, which I see that it is. So it's safe for me to go ahead and administer. At this time, I'm going to prepare my heparin, in which I will be giving 5,000 units. I went ahead and grabbed my heparin needle. I'm going to go ahead and grab my heparin vial. I'm going to be pulling 5,000 units, which is 1 milliliter. I'm going to go ahead and inject my vial and draw my medication. Since I have completed my Med Check 3, I'm going to use this time after I draw up the medication to call for a second RN to verify. I'm going to make sure I get all the air bubbles out, which can be tricky. Okay. I see that I got my 1 milliliter, which is my 5,000 units of heparin. I'm going to go ahead and do a safe scoop. Okay, I'm going to make sure I have my second RN verify the dose. All right, my second RN has verified, so I'm going to go ahead and administer my medication. So I'm going to go ahead and grab my alcohol pad. All right, Mrs. Cruz, you're going to feel a little poke into your abdomen, okay? I'm going to go ahead, lift up the gown. Go ahead and scrub for at least 20 to 30 seconds. Allow it to air dry. I see that it has now air dried. So I'm going to go ahead. I'm going to give you a little pinch, okay? A little poke. I'm going to lift my injection up. I'm going to make sure my patient's not bleeding. Activate my safety lock, and I will dispose that at the end. Cover you up. All right, and now I'm going to be giving your IV piggyback medication. And so I have looked up into my drug guide book, and this medication is going to be infusing in 15 minutes. So I'm going to make sure I program my pump that way. Okay, so I'm going to go ahead and pause my pump. I'm going to go ahead and lower my primary bag. I see that it is sodium chloride and it's infusing at the right rate. I'm going to go ahead and hang it. I'm going to go to the port closest to my primary bag, and I'm going to go ahead and use one of my alcohol to scrub the port for at least 20 seconds. Allow it to air dry. And we untangle my lines. Okay, I'm going to go ahead and connect my secondary tubing into that port. I'm going to ensure that my clamp is open. I'm going to lower my secondary tubing chamber below my primary line to back prime the tubing. Allow it to back prime at least halfway and get all the air bubbles out. Let's see over here. I see that my chamber is filled up halfway. I'm going to go ahead and clamp my secondary tubing and grab my Heparin medication. Go ahead and remove all the covers. I'm going to poke my secondary tubing. Go ahead and hang it up. And while my pump is still paused, I'm going to go ahead and program my Heparin at 15 minutes. So I'm going to push channel select and push secondary. I'm going to use my little alphabet guide right over here, in which it's going to be in that range. I'm going to push L, and I see that my pump is already in the page of the letter L medications. I know that the medication's name is also levetiracetam or Keppra, so I'm going to go ahead and choose that. It's going to be infusing at 500 milligrams according to my MAR, which matches my bag, and so I'm going to program it at the milligram dosing. It's asking me if I want to program it in milligrams within mLs, which I'm going to say yes. And I'm going to enter what is on my order that matches my IV medications label. So I'm going to enter 500. And it says here that it's a 100 milliliter bag. Within a 100 milliliter bag, everything matches. So I'm going to go ahead and enter that. I'm going to make sure everything is correct. I'm going to hit next. And I see here that it's going to go at the rate of 400 milliliters per hour at the duration of 15 minutes for a volume to be infused of 100 mLs, which matches everything from my MAR all the way to my Davis drug guide. So I'm going to go ahead and push start. There is a reminder for me to go ahead and unclamp my secondary tubing, which I will do right now. And I'm going to go ahead and hit confirm and wait for the first few drops. The first few drops have started. This will be infusing in 15 minutes. All right, Mrs. Cruz, your IV medication is now infusing. Do you have any other questions for me? No, you don't. So I'm going to go ahead and gather my supplies to dispose at the proper receptacle. I'm going to go ahead and lower the bed to the lowest level. I'm going to ensure that my bed brakes are locked and that my call light is within reach. And I'm going to go ahead and remove my gloves and exit the room. So while there are other ways that your instructors may show you how to insert the needle into the vial, I'm going to show you the proper ATI way. And so you're going to go ahead and prepare your needle. You're going to scrub your vial for at least 20 seconds and allow it to air dry. You're going to go ahead and safely uncap, and you are going to poke the needle into the vial while the vial is on the table, and you're going to go ahead and draw up the appropriate dose. Again, we are facing air bubbles, which is okay as long as you get them out prior to inserting it into your patient. Okay. And this is going to be a single dose vials because most heparin doses for a subcutaneous injection is going to be a single dose vial. Meaning this vial is going to only be used once for one patient.